If you have a client come in with a missed period who's now having some vaginal spotting and unilateral abdominal pain, what do you think could be going on? It might be an ectopic pregnancy. Now, an ectopic pregnancy happens when the fertilized egg implants outside of the uterus where it normally should and implants somewhere else. That's usually going to be up here in that fallopian tube. Now, that makes it non-viable and potentially life-threatening. I want you to think of it this way. There's no room for a roommate up here in that fallopian tube. No room to grow, no room to stretch, and that's going to increase the risk of a fallopian tube rupture. So what are our risk factors for this? Now, it can happen to anyone, but things that increase scarring are going to increase that risk for an ectopic pregnancy. That egg is like, nope, I don't want to implant down there, and it gets hung up on some scar tissue or stays away from the uterus because of scar tissue. So that's going to be things like prior tubal surgery, chlamydia, gonorrhea, sexually transmitted infections, as well as intrauterine devices that are used as a contraceptive. So that egg says, nope, I'm not going down to that uterus, and it can implant elsewhere. However, remember, it's most normally found in that fallopian tube.